Hello, my name is Nathan Brumbaugh with Drive Medical. Today I'll be presenting our electric patient lift, item number 13242. The purpose of today's video is to outline each of the components on this lift and the benefit it has for both the patient and the caregiver. I'd like to start out with the cradle. This lift comes standard with a 6-point cradle. The advantage of having a 6-point cradle is it's very functional for any type of sling. It has multiple points of contact, allowing for different positions of each of those types of slings. The cradle itself is attached to the boom. The boom is what raises and lowers the overall height of the patient. The boom itself doesn't swivel from left to right, but simply goes up and down. The motor is attached to the boom, and the motor is powered by the battery. The battery on the back of the lift here is both removable and rechargeable. The battery box, you'll see, has a red emergency button on it. The red emergency button disconnects the functionality of the hand pendant. The hand pendant has two buttons that simply raise and lower the boom. The benefit to both the caregiver and the patient of having the emergency switch is that they're able to disconnect the function or the controls of the hand pendant while the patient's in the up position, therefore eliminating or reducing harm to the patient by accidentally hitting one of the up or down buttons on the hand controller. Moving down the mast, you'll find that it has two push handles as well as a foot plate to allow more control when maneuvering this or putting this in position to transfer the patient. Further down, you'll see that you have a separator bar which expands the overall leg's base. And that's important. That's important to make sure that those legs are completely widened. That way you spread the patient's body weight over a larger surface area, reducing this patient lift from tipping left to right. The lift itself has 4 swivel casters or 4 swivel wheels. The back 2 casters are also locking. That's nice, so that way if you do have the patient elevated with the base widened, you can lock the casters and you don't have to worry about the lift itself sliding or shifting around. So if you did need to take your hands off the lift or off the patient, you can still function by changing the sheets or grabbing something off the overbed table. That really details out both all the components and the features of this unit. I appreciate your time. Please visit drivemedical.com if you have any further questions.